Hi guys, my name is Brittany. This is my presentation for my Change Quality Management Project, also known as PDSA project. My topic today will be safety improvements for suicidal patients with an emphasis on constant observation and constant observers. So, problem identification. So there are approximately 30,000 suicides per year in the United States, and through research, I found that 5 to 6% of these suicides actually occur in acute care settings. It has been found that important observations may go unnoticed by the observer or fail to be communicated to the team due to lack of training and education. So, a lot of research out there shows that, constant observers are lacking in training and education, and they're not communicating what they need to communicate to the care team, such as nurses. Um, and the need for better communication of critical information between staff caring for the patient was actually found to be one of the most common root causes of suicide in the acute care setting. So definitely these constant observers need to be properly trained, and they need to better communicate with the staff involved in caring for these patients. Quality standards. So at the hospital I work for, constant observation is required for patients who have active suicidal ideation or have had a suicidal attempt or have demonstrated or threatened self-harming behaviors. So if patients come in, having active suicide ideation, having an attempt, or stating that they want to harm themselves, we call the doctor, get an order for constant observation. So the purpose of constant observation or a constant observer is to prevent injury to our patients and to help keep them safe. So for the hospital I work at, we have training for our constant observers. It's just an initial 4-hour training class that these staff members need to attend. And so only these trained staff are allowed to sit as a constant observer for our suicidal patients. Quality variance. So the expected outcome of our constant observers is that they're required to observe the suicidal patient and maintain a safe environment at all times. So the goal is for 100% policy compliance for our constant observers in order to keep these suicidal patients safe during their hospitalization. Quality variance. So on my unit, recently, it's been observed that our constant observers are not following policy and are not fully understanding their role in helping keep these suicidal patients safe. So we have found that our constant observers are constantly on their phone. They have their phone on them. They're texting. They're watching YouTube videos. They're not being within arm's reach of our patients. So these are all things that are stated in the policy that they should not be doing, but it's still happening. So it's definitely a big issue. Root cause analysis. Constant observers are not familiar with the policy. So through some, analysis of, speaking to these constant observers, we found that they're not familiar with the policy. Found that proper handoff is not being carried out. Expectations are not being communicated at the start of their shift. A lot of times I had constant observers tell me that they're not getting handoff from the previous constant observer, and also they're not being given handoff or a report from the nurse. So it's definitely part of our everyday practice that we are required to give handoff to from constant observer to constant observer, but also from a nurse, a registered nurse, to the constant observer in case anything was missed. And we have to make sure that they are aware of their expectations and anything that they should be communicating to the nurse to help keep our patients safe. we also found that nurses are not following up with constant observers if they see them not following the policy. So through some observation, I found that I noticed that nurses would go into a patient's room, they'd see these constant observers, texting on their phone, browsing the web, watching YouTube videos, not being within arm's reach of the patient. And they're doing nothing about it. So definitely these nurses need to follow up with these constant observers, educate them on what the policy is, and make sure that they get rid of their cell phones, make sure they're sitting within arm's reach, and following up to make sure that they are fully aware of their roles and responsibilities as constant observers. Scope of the problem. So constant observers are not being educated on their roles and responsibilities. So they are required to have that 4-hour training, for example, at my hospital that I work for. So they're required to do that training, but after that, there really isn't any other training or any follow-up that they need to do with that. So definitely we need to educate our constant observers about the policy, remind them of what they should and should not be doing. Also, the constant observers are not being provided with proper follow-up from management if they are not following the policy. So really there's being nothing done if they see them, breaking the policy. And then also they are not being disciplined if they're not following the policy. So the key stakeholders in my situation, Scripps Health, nursing unit management, leadership such as supervisors, charge nurses, staff nurses, constant observers, physicians, and patients. So those are all key stakeholders for this problem. Solution. So after doing, an analysis, I came up with a solution to help these constant observers follow the policy. So I came up with a tracer tool in order to determine if constant observers understand the policy and their role. We're going to educate the constant observers of this policy through that tracer tool, frequently round on them to make sure they're following their policy and ensure that constant observers have taken all their breaks. Improvement goal. So the goal is that constant observers will be 100% compliant with the policy and their responsibilities after implementing this constant observer tracer tool. Justification of the solution. So recent studies showed that providing more education on observation protocol has been proven to achieve the desired goal of maximizing patient safety. So definitely, providing more education other than just their 4-hour initial training will definitely help keep these patients safe in the hospital. And studies have shown that sitters may be distracted, fall asleep, leave the room, be tricked by the patient into leaving him or her alone in the bathroom. So, like I stated earlier, these constant observers are being distracted because they're sitting there on their phone, which they know that they should not be on their phone. They fall asleep because, our hours are 12-hour shifts. So, it's a little hard, I understand, sitting there in a room with a patient for 12 hours straight. So we definitely need to ensure that these constant observers are taking their break and just frequently rounding on them. And a common issue that many observers face is that they're uncertain of exactly what their duties are. So creating a standard will help remedy this issue. So this tracer tool is a good tool to use to make sure that the constant observers are aware of what their duties are, what the policy is, and everything they need to do to help keep these patients safe and help prevent suicide from happening in the hospital. Solution implementation. So this is the tracer tool that is being used on my unit. There's just it's just a list of questions that we go through with the constant observer. It'll either be management, leadership, such as a supervisor, charge nurse, or sometimes we have our resource nurse go to each room and fill out this tracer tool. So basically, we ask the constant observers if they know why they are assigned to the patient, what is their medical diagnosis. We ask them things that, is in the policy, such as, being within arm's reach of the patient. We ask them the questions if they're being transported, if they need to stay within arm's reach. And those are just based on how they answer these questions. We know if they are fully aware of the policy, and if they answer the questions incorrectly at that time, we go ahead and follow up and make sure that they are fully aware of what their roles and responsibilities are. And once this form gets completed, it'll be placed in our manager's mailbox, and it will be reviewed, and she will follow up with anything that we need further education on. Analysis. So we did some data collection after we implemented this, and we found that a lot of the COs are not fully aware of their roles and responsibilities. There were multiple questions that were being missed. So after them answering the questions incorrectly, we would follow up, give them the proper information that they needed in order to understand their roles and responsibilities. And then another thing found was that they were actually answering these questions correctly. However, they were not following the policy. For example, they knew that they weren't able to sit there on their phone texting. They knew that they had to be within arm's reach. They knew that, they had to keep a close eye on the patient while the patient was in the bathroom, but these things were not being followed. So, more frequent rounding was provided in addition to the tracer tool that we implemented. How will the solution be continued? So this tracer tool will be used to ensure constant observers for suicidal patients are well aware of the policy and rules. So this tracer tool will be completed at the beginning of the shift to ensure that, the constant observers are aware of the roles and responsibilities, set our expectations of what we need them to do. And then they will be instructed at the beginning of each shift during these rounds of completing these tracer tools, so they are going to be held accountable for their roles and responsibilities. So if they're not following policy, there will be discipline that will have to be followed up on. And then more frequent rounding on the constant observer by staff members is another solution to this problem. These are my references. Thank you.